And then the largest study we've seen published is looking at 250,000 wellness visits from over 5,000 practices. And this data was published in this Promoting Preventive Care Protocols that AHA released. And they found in this data set that abnormal results just based on the CBC and chemistry, not even the paired urinalysis or any other advanced testing, was found in 1 in 7 adults, both in dogs and cats combined, 1 in 5 seniors, and 2 in 5 geriatrics. And again, when we say abnormal results, I'm not just saying that the alkaline phosphatase was mildly elevated, right? Actually abnormal that warranted further clinical workup, right, or a diagnosable disease. And having that data has then influenced our recommended protocols. Some of the guidelines we're getting from some of our organizations like AHA and AAFP and the feline life stage guidelines around recommended diagnostics. So they're now recommending going on beyond the infectious disease testing that has become more commonplace as part of our wellness visits to extend that to include a CBC chemistry urinalysis, right? Recommending as a young adult to get baseline testing, thinking about it more commonly during the mature adult years, as we saw in that study, right, that we saw the increasing disease as the pets were getting older, and then considering it even more frequently than annually, maybe even biannually in the senior pets, given, again, that frequency of recognizing these rapidly developing problems. And then in our dogs, right, so AHA guidelines as well for dogs appear similar in parallel, saying going beyond the infectious disease recommendations that, again, most of us are quite familiar with, but to include the CBC chemistry and urinalysis, recommending considering a baseline as a young adult. And for both dogs and cats, this is outside of any recommendation for pre-anesthetic testing, right? So many of these pets will get their first lab work done as a pre-anesthetic testing before a spay or neuter, right? But outside of that, having some young adult value to know what normal looks like for these healthy pets so that during their mature years when they're recommending annual testing, we get more sensitive and early detection of disease, that we're looking more frequently in our senior pets for such changes. I'll give you an example in our own practice, right? So the practice that I consult at, we have a patient named Clementine. She's a 12-year-old female spayed domestic long hair, regular patient of ours coming in for her annual exam or her wellness appointment. We hadn't seen her in close to a year. When she was in previously, she had had a dental prophy performed. And on a physical exam, they had seen return of some of her dental disease, no other clinical concerns on physical exam or by the pet owner. So when I talked during this wellness visit about what preventive care looks like at this age, right, we talked about the infectious disease risks and what diagnostics or what vaccinations we would consider for Clementine, then also talked about the value of getting some more baseline data for her, right, expanding that wellness profile to include a CBC chemistry and urinalysis as recommended by our guiding AHA guidelines. The owner agreed, and we sent that lab work all combined out to the reference lab. As we get those results back, her CBC looked beautiful, everything fell nicely within the reference interval, and we had comparative data from the year before to say there was no significant decrease in hematocrit, no concern for, an atypical lymphocyte population, no signs of inflammation, etc. On her chemistry panel, while we did not see any significant changes for the majority of the measurements reported, they did recognize a hypercalcemia. And this, again, was a new finding for her, given that we had lab work from the year previously when the total calcium was reported at normal or within the reference interval. So this was a concerning new change for her. When we paired it with urinalysis, fortunately, the urine-specific gravity was nice and concentrated, excellent for a 12-year-old cat at 1042, and also nice concentration for a cat that we're worried about in the face of hypercalcemia. So this particular veterinarian looked at these results and hadn't actually worked up a cat with hypercalcemia and reached out to the consultation services at Antech to get some feedback on how they should manage the rest of this workup. I think many of us who have handled hypercalcemic patients get nervous when we see that elevated total calcium because of the possibility of underlying malignancy driving that hypercalcemia malignancy. Of course, there are a list of differentials, and as this practitioner talked to the internist at the consultation team, they went through the history for the cat, the rest of the lab work, and deduced that the primary considerations for working up would be an underlying malignancy, as we talked about, especially as the cat is getting older, possible underlying hyperparathyroidism, less common in cats than in dogs, but certainly a possibility, or idiopathic hypercalcemia, right, where we don't know the underlying cause. We haven't been able to identify it. This is much more commonly seen in cats than in dogs. Those are the top 3 considerations for Clementine, as they are for most cats with a high total calcium. So they progressed first with looking through her imaging diagnostically, looking for a hunt for possible underlying malignancy. I'm only showing a 2-view chest here, but they did do 3-view chest radiographs and detected no significant abnormalities outside of some aging changes. And they did a full abdominal ultrasound, similarly found no concern for underlying malignancy. So that was a relief because that was the primary concern, certainly for the pet owner once she heard the differentials. So they then sent out some more advanced lab work to the reference lab, looking at parathyroid hormone testing, right, to investigate whether it could be underlying hyperparathyroidism driving that total calcium. When that's sent off through the reference lab, ultimately gets sent to Michigan State where they do this hormone testing. They confirmed that high total calcium was elevated, but more importantly, that ionized calcium was elevated. I say more importantly because that ionized component of the total calcium, right, is the one that is biologically active and hormonally controlled. And the body really tries to keep that into a very tight window because when calcium's too low, right, we need it for our muscle contraction, including that big muscle of our heart, right? But also if it's too high, then we can get mineralization of our tissues and deleterious effects on the kidneys. So the ionized calcium was indeed high, so something we do want to intervene at. And the paired blood work that goes and looking at the hormone testing, right, that parathyroid hormone in relation to the high ionized calcium detected an appropriately low parathyroid hormone, right? Again, the parathyroid hormone, the parathyroid gland should get that negative feedback in the face of that hypercalcemia, right, and then decrease the amount of parathyroid hormone secreted, which was appropriate in this case. So that did rule out underlying hyperparathyroidism. So Clementine had a presumed idiopathic hypercalcemia. Again, this veterinarian reached back out to the consultation team to say, well, now that we've figured this out, how are we going to treat it? They had a consultation with a double board certified internist and nutritionist to help guide them on some nutritional management as well as supplemental management as well. Getting some earlier intervention, right, at the stage where she has no clinical signs and her urine specific gravity is really well concentrated. We want to intervene as early as possible to keep those kidneys feeling as good as possible, as long as possible. So Clementine visit, again, as I mentioned, starts as a wellness visit, right? We looked sort of under the hood, if you will, get objective data to look more sensitively at a 12-year-old cat to make sure she is indeed healthy. Right? Again, studies will tell us that as cats get to middle age and older, that it's not uncommon to discover these abnormalities. So through her CBC chem and urinalysis, we identified the hypercalcemia with a concern for possible underlying malignancy. They had imaging done, which fortunately detected no abnormalities, and she had an appropriate low parathyroid hormone, right? So no underlying hyperparathyroidism. Presumptive idiopathic hypercalcemia that then with a consultation allowed them to guide treatment recommendations for this pet owner. This is something that they are going to work on through diet changes and supplement changes, as well as trending of lab work, right? Repeated lab work and a plan for when they were going to recheck it, adjust some of our interventions as needed to keep that calcium level low and those kidneys functioning as good as possible. And so, I speak to you about the value of doing this wellness testing, and I think it resonates pretty well in understanding amongst veterinary teams why this is important. But we are really lucky to have Jason with us tonight as well, so he can talk to you about how we're going to communicate that to the pet owners. Back to you, Jason.
Thanks, Holly. And so as Holly mentioned, she's done a really nice job of building the basis for why wellness testing is important from our understanding. The next step, though, is how do we actually communicate that in terms of value of wellness testing to a client? And so I wanted to start off with a study that was done with over 2,000 pet owners surveyed. And of those that didn't follow through with the veterinarian's recommendation, what they found was client uncertainty and lack of perceived value many times far outweighed concerns about cost. So that's not to say that there aren't clients that have cost concerns, particularly in today's environment. And yet what this finding found really was that more times than not, it was clients' uncertainty and lack of perceived value that led them not to follow through with the recommendation. And when they explored this further, what they found was it was how well we as veterinary professionals explain the reason for our recommendations. It really drives a client's perception of value and the quality of care that we're offering. And so tonight I wanted to spend some time sharing some work we've done looking at how we communicate value. And I think as we think about how we communicate value, the first thing we need to recognize is that value is subjective. The value of a procedure, product, or service we can offer a client The value is not inherent, rather, it's going to vary from person to person based on that person's rating of how useful and important that procedure, product, or service might be. And you can probably appreciate it. If I was to sell you a chocolate bar, the value of that chocolate bar is going to vary from each individual that is watching this webinar. And it's going to vary depending on probably how much you like chocolate, how much money you maybe had to spend on that chocolate bar, how hungry you are. And so there's all kinds of different factors that play into it. And similarly for our clients, when making decisions as to what services, products, or procedures they're going to pursue for their animal, there are factors that play into each individual's decision in relation to their perception of value. It might be the relationship they have with their animal, how much money they have, or the position that they're currently in, all kinds of different factors that we really need to understand so that we can communicate value in a way that is relevant to that individual client, their animal, and their situation. And so this is where starting our conversations around value with clients is really understanding what our client standing in front of us values. And we use a tool, a communication tool we call open-ended inquiry, which are either questions or statements that really invite clients to share information with us so we can use that information to really tailor how we move forward in our conversation with them. And so in terms of exploring what a client values, we can use stems like tell me, describe, walk me through, really to open the conversation and better understand what that client standing in front of us values in terms of care for their animal. And so it might sound something like, tell me your goals for Joey today. By putting those out onto the table, it really allows me as a veterinarian to better make sure that our conversation aligns with those goals. Another example might be, describe for me what's most important to you when making a decision for Joey. I find this quite useful because it lets me know what is this client prioritizing in terms of what they value. By knowing that, it allows me to work with that client to see how I can meet them where they are. Really find that common ground to really make a recommendation for moving forward that all parties are going to be invested and ultimately committed. And then the final example I'll share with you is, walk me through a typical day for Joy from when he wakes up to the end of the day. And I like this just as a general starting question because it gives me a ton of information. First, it creates some structure to help the client recall information as to a typical day for them and Joey. But it oftentimes gives me ideas of the type of things they like to do together, the places they go, the individuals they interact with, maybe the food that they're feeding. And by having that information, it starts to give me some appreciation of the things that they value and an understanding of the relationship they have with their animal. And so the real starting point to all of this is really understanding what our individual client values through asking them open-ended inquiries. Another thing that we need to consider is making sure we avoid questions that start with the word why. And the reason behind that is why questions tend to put people on the defensive. Why have you chosen not to pursue wellness testing for your animal? Now the client feels like they have to justify. And so we want to open these conversations in a very comfortable way where clients can share their thoughts, their beliefs, their values, and not put them on the defensive. Another thing that's important for us to consider as it relates to value, particularly as it relates to wellness testing, is the idea of temporal discounting, which is really recognizing that the greater the delay to a future award, the less subjective value it has today. And so if I asked you to do something and offered you $1,000 today to do that, the value in that is greater than if I ask you to do something today and I offer to pay you that $1,000 in 3 months from now. And so that 3 months time delay actually decreases the value of that $1,000. So $1,000 in 3 months is no longer equal to the $1,000 that you could get today. And it's important, I think, to recognize that in the context of preventive care. So I think about it in terms of veterinary medicine. An animal comes in, sick animal comes in, we work that up, we make a diagnosis, which informs our treatment or management. We recommend that to a client. The client today sees the value today in pursuing treatment or management for their animal. Preventive care, though, we're asking them to do something today, oftentimes for a reward that is going to be off into the future. And so it's important for us to recognize that it's hard to convey value for something that's going to be in the future. And yet what also being found is that the larger the future reward, larger future rewards are discounted less steeply in value than smaller rewards. And so this really, I think, is important as we think about communicating the value of wellness testing, communicating the value of preventive care, is that we need to be communicating that value in terms of that large reward down the road in time that their animal and they are going to receive. And so it really comes back to how we communicate the value of preventive care, how we communicate the value of wellness testing. And so on that front, we've done a lot of research over the last 20 years, some of it involving qualitative focus group work, others more observational. And very early on in our qualitative research, when we were doing focus groups with pet owners and focus groups with veterinarians, when they got into talking about particularly the cost of veterinary care, we recognized that there was a real difference in the way that pet owners and veterinarians discussed value. And so they seem to approach it from very different perspectives. Where in our work, pet owners always discussed wanting to understand the value of veterinary care in the context of how is this going to contribute to the future health and well-being of my animal. And study after study in veterinary medicine has highlighted that for most clients, what they value is how is this going to impact the future health and well-being of my animal. What was interesting, though, was in our veterinarian focus groups, veterinarians often focused on the importance of making sure clients understood the time, the service, the effort that went into the things that they could offer for their animal. And as a veterinarian, I appreciate that. We've got all of these different pieces of equipment. We've got a team. We've gone through years of schooling to be able to offer different services, products, and procedures for our clients. And as much as clients appreciate that, at the end of the day, what they really want to understand is how is any of that going to contribute to the future health and well-being of their animal. And so following this research, we went out into veterinary practices and put cameras up in the corner of the examination room and looked at the interactions between veterinarians and clients. And we did this almost 20 years ago and then more recently repeated this study. And the findings on the screen are from the more recent study where we had 917 recorded interactions involving 60 veterinarians. And we picked out the interactions where there was the mention of a cost within the appointment. And then we looked at, well, when those cost conversations happen, how are veterinarians communicating the value associated with that cost? And what we found was in 8% of interactions that contained a cost conversations, one of those cost conversations was just a general cost conversation. So it might sound something like, so you're going to save yourself about $20 today. 74% of the interactions that contained a cost conversation contained at least one conversation where the veterinarian only emphasized the time and service that they were offering. And so it might sound something, I recommend blood work for Rory. It's going to cost around $200. End of story. 42% of interactions that contained a cost conversation contained one that went that next step to communicate some form of medical information or how what was being offered was going to work. Might sound something like I recommend blood work for Joey. It's going to cost around $200. What it'll allow us to do is evaluate his kidney and liver enzymes. And yet only 14% of that time or interactions containing cost conversation included one that really went that next step to communicate how it was going to contribute to the future health and well-being of the animal. And so it might sound like, I recommend we do some blood work for Joey today. It's going to cost around $200. What it'll allow us to do is evaluate his kidney enzymes. And if we find the values above a normal limit, we'll be able to have another conversation, likely about changing his food, reduce the stress on his kidneys so he can live out a healthier and happier life. If we find that it's within a normal range, what it'll do is it'll give us a baseline to monitor Joey's kidney values over time. And as they start to change, we can start to be proactive and really address that before any problems creep in. And so what we realized as a profession, we tend to be very good at highlighting the features, the things that we can do in terms of time, product, services. We're not so bad at the function in terms of how that will work or what information will give us. And yet we really identified that there was this opportunity to communicate how is this going to contribute to the future health and well-being of a client's animal. And so we've been talking about wellness screening tonight. And so I'm curious, and I'm going to ask you to kind of think the answer to yourself where you are, wherever you're watching this webinar, is that when you or your practice offer a client wellness screening, are you in your practice offering your client a feature? Are you offering them a function, or is it offering a client a benefit? So when offering wellness screening, are you offering a feature, function, or benefit? So just want you to take a moment and think that through. And then I'd like you to actually verbalize it where you are, whether or not it's a feature, a function, or a benefit. So we don't have a poll here, and yet last week I had the opportunity at a global symposium to ask this very question of people in the audience, and the majority of people identified it as a benefit. And so I can imagine many of you identify it as a benefit, some identified it as a function, and few identified it as a feature. The reality is, wellness screening is a feature. It's really a service or a product that we can offer our clients. And yet, as veterinary professionals, we inherently see the benefit, and so we identify it as a benefit. Yet, our clients don't have the advantage we do of working in veterinary medicine and seeing that inherent benefit. And so they see it as a feature, and we need to communicate to them what is the benefit associated with wellness screening to the health and well being of their animal. And so it might sound something like by performing blood work screening for Max at his age, we can establish what is normal for him, which will allow us to detect changes in his health earlier. So far, all we've communicated is the feature, the blood work screening, as well as the function, how it's going to work, allow to detect changes in his health earlier. We want to follow that up and really emphasize the benefit, which would be saying something like, by catching things early, it'll allow us to proactively take action or make changes to help them live longer and have a better quality of life. And so not only is it the conversations we have with clients in the examination room, 2 years ago, we published a study where we thought, okay, well, what about other forms of communication? And so we wanted to explore clients' preferences for written communication as it related to the value of senior screening. And so in order to do this, what we did is we developed 2 paragraphs that could be posted on a website or within a clinic, really highlighting senior screening. And the first paragraph I've just put up onto the screen in front of you, and it was really a feature and function focused paragraph. So the words in yellow or orange are feature focused, so senior screening, chemistry panel, complete blood count, urinalysis, senior screening. The blue colored font is the function in terms of how it works. We'll provide your veterinarian with information about how several internal organs are working. We'll look for low blood cell counts, ongoing disease, and cells that help with excessive bleeding, can back up issues found on the blood work. So we gave 1 paragraph, which was very feature and function focused. The second paragraph we showed to participants had some benefit identified in the green font here to support the health of your pet. Faster you and your veterinarian can take action to help your pet and give you peace of mind. And so for the participants of this study, through 15 veterinary practices, we recruited clients that had a senior pet, and we put these 2 paragraphs in front of them, and we asked them, which of these 2 paragraphs promoting senior screening do you prefer? And what we found was 60% of those that participated preferred the benefit-focused paragraph. And so I think this is important for 2 reasons. One is that there was a preference towards the benefit-focused paragraph, and yet also some preferred the feature and function-focused. And so it's not that we just have to communicate the benefit, but it's important we identify the feature, the function, and the benefit when communicating with our client, both verbally, but also through written means. So following asking them their preference, we randomly showed participants one of these 2 paragraphs and then asked them, what's the likelihood that you would have a conversation with your veterinarian around senior screening for your pet? And what we found was those that were randomly showed the benefit-focused paragraph were significantly more likely to indicate that they would have a conversation with their veterinarian around senior screening for their pet. And so I really encourage you to think about how you and your team are currently communicating the value of everything we do, but in the context of today, wellness screening or preventive care to your clients, because we tend to be quite good at highlighting what we can do, not so bad at highlighting how it works or how we can use that information, but we really want to emphasize the why, the so what in terms of what is it going to mean for the future health and well-being of your client's animal. And so with that, I'm going to send it back to Holly at this point in time to really emphasize sort of some of the value associated with individual reference intervals. So Holly, back to you.
Sorry, I had myself muted. Thank you. So now, again, focusing on truly getting that wellness testing, those values from periods of health, from the younger animals we see on the right-hand side. And this really isn't so much about the clinical picture that we were talking about in the older pets where we're uncovering occult disease, but it's truly the value in holding that data. So something that I think that many have never considered is looking more closely at the currently published reference intervals that we use to interpret our lab data from our patients. The current reported reference intervals that you see alongside your lab work are going to be population-based reference intervals, and that probably makes sense to you, right? Understanding a little bit more about the details behind that, those reference intervals are determined by looking at hundreds generally at least more than 120 deemed healthy, let's say dogs in a particular scenario, right? So species specific, we're going to look at over 120 dogs. It's going to be a mix of different ages. We'll probably eliminate the pediatric ones, certainly anything neonatal, and we're going to eliminate the very old dogs as well, where again, we can expect to find some abnormalities even when they appear clinically healthy. But we're going to have a mix of different breeds, of different sizes, of different ages, whether they're neutered or not, everything from a 1-year-old teacup poodle through an 8-year-old St. Bernard, right? So you can imagine they are almost different species at that point, right? But the idea in establishing a reference interval of health is trying to say that what is the likelihood, right, that a healthy patient's values will fall within this reference interval, so it accurately detects health in that way. So what happens is we take an individual measurement, let's say hematocrit, and we'll develop this histogram of the data results. And so a histogram is going to be one of these curvilinear plots that you see here, where at the low end on the left-hand side where the curve comes down, those are going to be the lowest hematocrits that were reported from these healthy pets, right? Again, deemed healthy based on normal physical exam, owners reporting no clinical signs or concerns at home, not on any medication beyond preventatives. At the right-hand side there, you're going to have high values of the hematocrit. And so when we get this curvilinear look, it's because we're looking along the y-axis at the number of pets with that individual result. So we can see the vast majority of pets are going to have a hematocrit in the middle of this curve, as we see. And so what we'll take is we will look at the mean here of all those values, right? We drop down that mean and we'll go 2 standard deviations above and below, and that'll give us this 95% central distribution of the data, right? Meaning 95% generally, and again, this is normally distributed. Sometimes if not, we have to add some additional statistics in there. But largely, we're looking at a distribution of these reported hematocrits on these healthy pets, and we're grabbing the 95% central distribution. And what that means when we report that as the reference interval, it means that 2.5% of those healthy pets are going to have a normal hematocrit for them that's actually low outside the reference interval. Another 2.5% for them, normally, their actually reported hematocrit is going to be higher than the reported reference interval. So that's important to note, right? On an individual patient, that healthy for them may fall outside the reference interval. It will for 5% of the expected population that this serves. But I think even more importantly, it means that for an individual animal, it may be abnormal within this wide reference interval, right? Unfortunately, these population-based reference intervals are inherently wide, right? Because they incorporate so many different animals in different stages of life, right? Different breeds, different sizes, etc. We look again in using this hematocrit example. If we take the high end of that reported reference interval, and let's say it's 60%, right? That individual dog may have lost, a third or up to even half of their blood volume. And now their hematocrit, when they come and present to you, is something at 32% or 34%. That might be within the low end of the reference interval, right? So it may be, quote, normal, meaning not flagging low, but obviously dangerously decreased from what's normal for them. So again, there's some insensitivity to a lot of our population-based reference intervals in identifying abnormal. And it's really based on how well that population-based reference interval serves is based on the index of individuality for that individual measurement that you're looking at. What do I mean by that? So we take something like glucose, and this is looking at 5 different cats over a 2-week time period, repeated measurements of their glucose, and we can see the box and whisker plots for each of these cats, right? And so for each of these cats, the glucose, varied throughout those 2 weeks when an individual blood draws were performed. And you can see the gray box in the background is the reported population-based reference interval. And so when there's a lot of individual variability, so within an individual patient, their glucose varies a good bit throughout our days, it turns out that this population-based reference interval serves them quite well in identifying these normal ranges for them. But if we take a measurement like creatinine has a lot of very low intra-individual variability, meaning for an individual patient, the creatinine is going to remain stable, right, based on really just their hydration status because it comes from their muscle mass. And over a 2-week period and looking at these 5 different dogs where they repeatedly measured their lab work, and in particular looking at creatinine here, the creatinine did not vary very much for each individual dog. But it did vary a lot between the dogs, right, again, based on their muscle mass. So that gray box in the background, which is that population-based reference interval, does not serve very well to recognize what is normal for an individual patient, right? And so for them, a subject-based or an individualized reference value would serve them much better in detecting abnormalities, identifying what's normal so that we can detect abnormalities. Take another example here where we're looking at 11 different dogs, and we're looking at their lab data over a period of repeated measurements, over a period of weeks, I believe, in here as well, potentially months. And these dogs, we have the box and whisker plots again for their ALT. In the background, you can see at the top of the graph there, that dotted line, that's the high end of the reported population-based reference interval. And down at the bottom, in the dotted line across the bottom, that's the low end of that population-based reference interval. And we can see a lot of variability between these individual patients. That is why we have such a wide population-based reference interval. But again, detecting changes in an individual animal could be really challenging because of this. Because if we look at patient 8 down there, right, whose ALT and during periods of health is normally very low, and we interpret really a rise in ALT when it gets to 3 or 4 times the high end of the reference interval is when we really are concerned for hepatocellular necrosis. Right? But if we look for this patient 8 and we realize that between patients 8 and 11 there's an over 4-fold difference just between those 2 dogs in health. Again, as a consequence, we have that really wide reference interval of health, meaning for poor patient 8 there, we would not detect their significant rise in ALT as being flagged high without knowing what normal is for them, because it's going to fall within this general population-based reference interval. What does this look like in practice? Again, another example here, this cat is Tina, a middle-aged cat. She belonged to, if anyone knows Dr. Dennis Nicola, a clinical pathologist who's a wonderful friend and mentor of mine. And he has a lot of data points on his cat because, of course, he's a clinical pathologist. So he was drawing blood work on his cat quarterly, right? So we have every 3 months, we have blood draws on Tina. And in this particular graph here, we're going to be trending her creatinine measurement. So we see her trended line there between her individual values over a 6-month period. And again, the gray box in the background is going to be that population-based reference interval established for healthy cats. And so over this 6-month period, there's minimal change in her creatinine. But over the next 6 months, it started to rise, right? So we started getting a rise in her creatinine that, again, over the next 6 months, so over a full year later, finally is now showing a point that's high outside that reference interval. So we waited, and we only used this population-based reference interval because we didn't have her creatinine during periods of health. We would not be detecting this azotemia, right, until more than probably a year after her rise started, because he was also watching her urine during these periods of blood draws and recognized that her loss of urine concentrating ability happened back here, again, a year earlier. And so because he had data points in health, and was able to then sensitively trend that data, watching that rise in creatinine triggered him to look at her urine and recognize that early renal disease, right? Because this is when we want to start to recognize those changes, right? These are early iris stage 1 kidneys, right? And then before they recognize that azotemia, but as we start to see that loss of urine concentrating ability is when we want to intervene with our particular diets and other measures to try to keep those kidneys functioning as good as possible, as long as possible. And having those patient-specific reference values, because we truly have data points in health, allows us to have that sensitive and early detection. I'm going to pass it back to you, Jason, so you can talk a little bit about looking at those trends from a pet owner's perspective.
Thanks, Holly. And so, as Holly's identified, definitely value in those patient-specific reference intervals. And then the question becomes, well, what are clients' thoughts around trending that and creating those patient-specific intervals? And so a few years ago, we did a mixed method study where we really approached this idea of using trends to initiate conversations with clients. And so the first part of the study was running focus groups with both veterinarians and pet owners. And within the pet owner focus group, across all 5 focus groups that we ran, there was a real interest among the participants in utilizing or being introduced to trends. And they were very curious to know when it was increasing, decreasing, or even just staying the same in that normal range. And coming back to that why, pet owners in those focus groups constantly told us that they want to understand, well, what does this mean when it's increasing, decreasing, or remaining stable as it relates to that? So definitely there was support for this idea of trends. And so Following that, as a second part of that mixed method study, we went to our data set of 917 recorded interactions to look at, well, if there's this interest and it could be a really valuable tool to initiating these conversations and tracking well-being or wellness of an animal over time, how often is this happening in practice? And we actually found that only 8% of the interactions that we had recorded had any mention of a trend. And when it was mentioned, it was predominantly in relation to body weight. What was further interesting when we looked at the body weight element of it is that it was more commonly used, 2 times odds of it happening when the animal was overweight. So it wasn't being trends being used in a preventive fashion, it was being used in a reactive fashion. And so I think it really creates this opportunity for us to start having trends as a conversation earlier with our clients so we can track an animal's health. And the clients that we did in those focus groups indicated a real interest in that. And that brings me to this idea of introducing trends early. There's been some really great work done looking at kitten and puppy weight growth charts. And I think it's a great way of introducing the idea of trends early to a client in a way that isn't going to cost anything. So they're bringing their animal in, you take the weight. Many electronic medical record systems already have the ability to track that or map that or graph that in terms of the medical record. What we heard from the clients in our study around trends is they wanted to know what was the normal. They also wanted some differentiation in terms of color so they knew where the boundaries were on that normal. And so by starting with weight trends, it gets them used to trending. We can keep that animal within a normal weight. By the time they get to a mature weight, we know what their ideal body weight is going to be and can track that for the rest of their lives. And so on that note, we've done some further work around pet weight. And one of the things that we wanted to do was when an animal is overweight, we were curious as to, well, what are some of the things or information that a client would be interested in that might lead them to take action on a veterinarian's weight recommendation. So we did a very complex study using discrete choice where we basically created a vignette, which is on the screen here. Your veterinarian mentions that your dog, cat is overweight and makes a recommendation to have your pet lose weight. What set of information would encourage you to act on your veterinarian's recommendation? So rather than just ask them what they would take to act on their veterinarian's recommendation, we actually gave them the same vignette 12 different times, and each time there was a different combination of different sets of information. And based on which set they chose each of those 12 times, in the background, we were able to select what are the things that they really identify as being most important to them that would motivate them to take action. And so we did a dog study and we did a separate cat study. Both of them had over 1,100 participants or clients involved in each. And what we found was for dog owners, impact on life expectancy was number one thing in terms of importance that would lead them to act on their veterinarian's recommendation of an overweight animal, followed by timeline for developing arthritis, future quality of life, change of cost, future mobility. In our cat study, we found impact on life expectancy, number one, future quality of life, change to cost of food, future mobility, risk of developing diabetes. And as you can see, in that previous slide, is that quality of life and increased lifespan were high priorities for both dogs and cats. Increased lifespan by far. Well, when we've looked at this in veterinary practice in terms of conversations that veterinarians have and technicians have with clients around addressing a pet's overweight status and the reasons why they suggest that that should happen, oftentimes they're focusing on mobility or arthritis or diabetes as the reason, and very rarely on increased lifespan and quality of life. And so if we go back to that concept of really focusing on a client's why, what we're hearing from our previous study and the previous slide is that clients want to know, and what will motivate them is how it's going to impact on their pet's lifespan, quality of life, and yet that's rarely what we're putting into our conversations. And so I highlight these two studies just to emphasize that it really becomes important for us to understand what our client's why is so that we can really communicate that in relation to the recommendations we're making as it relates to wellness and wellness testing. And so as I end this section, just reminding that this whole idea of wellness testing, we need to think about temporal discounting, where something that has a reward today isn't going to be the same value as a reward that's off in the future, which really fits well with preventative or wellness care. And reminding ourselves that the larger future rewards are likely to be discounted less steeply in value than smaller rewards. And so we really need to be communicating the value, the future value of preventive care, of wellness testing for a client's animal. And so we want to focus on that by thinking about establishing those individual reference intervals so we can track and detect disease earlier for a client and their animal so that we can keep them healthier, maintain their quality of life, and help them live out a healthier and happier life.
And so when I summarize my talking points, right, on unleashing that power of wellness testing, again, getting that more objective assessment of health. I think that we are pretty used to having these conversations with pet owners on why we have to run diagnostics, right? I think they understand that our physical exams can be limited. Often the histories are a little sorted. And so having that objective assessment allows us to develop further insights so that we can make more accurate diagnoses. Right, but truly during periods of health, developing those patient-specific reference values, right, understanding early on that those reference intervals that we're commonly using are insensitive in detecting abnormalities and certainly in early detection of abnormalities. So we can develop those patient-specific reference values, having those periods of health, knowing what that truly looks like for the individual patient, allows us to sensibly trend data for early detection and early intervention of disease.
And so I really encourage you, going back to your practice, to really give some thought to how are you communicating the value of the things that you're offering your clients, particularly when it comes to wellness testing. And how are those around you communicating? How is your clinic communicating the value of wellness testing? And when you are approaching the communication of value, really do start by understanding what it is that that individual client values for them, their animal, and their situation. Oftentimes, it's going to relate to how is this going to benefit the future health and well-being of my animal. And research is starting to suggest that really helping clients understand by investing in wellness testing today, we can help track and maintain the health of that animal over time so that they live longer, healthier lives, is how we communicate that future benefit and reward. And with that, Amy, I'm going to pass things back to you to wrap things up.
All right, great. Dr. Brown, Dr. Coe, thank you both so much for this amazing presentation. We are going to go ahead and get to some questions just before we do. I would like to give another huge shout out and thank you to Antech Diagnostics for sponsoring this webinar. Seriously, they are an amazing educational partner, and because of their support, the recording of this webinar will continue to be available and free to watch on our VetGirl website until December 31st. And a message from Antech: tonight and every night, Antech's goal is to provide education to help you in your clinical day-to-day. In response to feedback, we've provided a way for you to connect directly with an Antech team member for specific diagnostic information through the QR code you see on this slide. And just a quick reminder to our audience that the CE certificates will be automatically uploaded to the My Credit section of your VetGirl accounts within 24 hours. And if you have any trouble receiving that certificate, just reach out to us through the contact form on our VetGirl homepage, and we'll get that to you right away. And as we begin with some of the questions that are stacked up in queue, please take time to locate that Q&A box and toss in any additional questions, feedback, shout outs, or kudos for our guest speakers and for Antech, and we'll make sure to pass that all along. All right. So first, I just wanted to ask, and forgive me if I missed this earlier on, but the information you provided tonight, Dr. Coe, about the client-focused studies was really amazing. Is there a place that we can access that information and that research?
Yeah, great question, Amy. So we've done multiple focus group studies over time. And so, I mean, they're kind of here, there, and everywhere. And yet our research team now keeps a collection of all of our publications. And so if people were to journey or Google relationship-centered veterinary medicine at the Ontario Veterinary College and go under our research tab to publications, there will be the references to all the different qualitative focus group. And we also do several interview-based studies, sometimes one-on-one interviews with clients to really better understand kind of where they're coming from and how that can help inform how we engage them in conversations, recognizing that everybody's going to be a little bit unique, but that at least gives us a starting point to understand the client perspective.
Excellent, thank you. And now this next question, I might stretch us a little bit here. So, Dr. Brown, you and I were talking about like how important this focus is on trying to figure out what the clients are hearing us say and what is really going to motivate them to take action. And so a big part of that is obviously going to be happening in the exam rooms. But in today's day and age where everything is now online, everything, social media, Dr. Ko, has any of your research team looked into things like our veterinary clinics' social media posts and how information about, like, if somebody makes a post talking about like wellness exams or the importance of, senior wellness exams in particular, has anybody looked into how those posts are reaching the clients and what things we might be able to do to better the message that we're sending to them?
Yeah, so I would say the closest we've done is the study that I referenced in the talk tonight, where we built those paragraphs. And so the reason we did it was we wanted to understand content that would be put online. So we used it in the context of a website, but I think the same principles apply to any online medium that you might be engaging clients around. The other thing, which I didn't share in that work we did, was that we actually looked at several veterinary clinics websites to assess how were they communicating around different wellness or preventive care type things. And what we found was there was a lot of focus on feature and function and less focus on the benefit for the client, but also particularly the benefit for the pet. And so I think when you're building any online content, I really encourage you to think beyond the product, the service, how it works, to what is the benefit to the animal particularly, and how do you build that into your message, which was what we found when we did that for the online examples. People tended to have a greater preference for it. They were more likely to engage with their veterinarian. And so I think some of this too, not always in a post on social media do you have the characters that you can really emphasize that. And so that can also be a way where you really encourage them to recognize that by having this conversation with their client, there is a benefit to potential health and well-being, and yet it needs to be tailored to the individual client, their animal, and situation. Just encouraging them to have that conversation with their veterinarian or veterinary practice, I think, can also be helpful. So to just kind of summarize that, I think our work has pointed to the fact that online communication, highlighting the benefit, is also important. It's not necessarily happening a lot. And so I encourage people to do an audit of their own online communications, both on their website, social media, and otherwise. And I think sometimes when we're limited, just giving a bit of a nudge so that they're aware that this is important and that it is something that they should talk about, how it's going to impact the health and well-being of their animal with their veterinary team, can be sort of a solution to trying to manage some of that as well.
That's excellent. Thank you so much. And I did just pop up the Antec QR code there for a little bit, just for one of our audience members. But yeah, just looking at our message board here now, and it looks like we've got everything pretty much wrapped up here for the evening. So this was really great information. And you can see, this is really well received. We are getting the message that we've got to work on how we are communicating to clients in the best, most effective way possible for, the health and the well-being of our pets. So this was fabulous. I really appreciate you both helping to open up this conversation for us and teach us, your tips and tricks on how to word things to clients in the best way. So this is great. So we'll go ahead and wrap it up here for the evening. Dr. Brown, Dr. Ko, thank you both so much for answering our questions and for this excellent webinar. It's great having you with us. And as always, we are super thankful for Antec's support with these educational webinars. And to our audience members, thank you all for tuning in. We really appreciate you carving out this time to listen and learn with us here at VetGirl. Until our next VetGirl event,